Good morning, everyone. My name is Simone Rurig, and this morning we'll be doing partial bed bath. Remember, guys, all the skills that I'm uploading is for helping you guys when you're going to do your exams. Remember, the videos that I'm making is actually videos that I'm trying to put on my YouTube channel for you guys, and I'm also trying to explain the reason behind why certain things are being done or is done. A lot of us find it complicated to learn our skills, and this is a breakdown of the skill. And the skills that I'm doing is from the New York State Board. All right. So persons keep asking me where I'm from and what. So this is the New York version, guys. I hope the skills that I do, they're informative, and also I hope that they help you to succeed in your exams. Now, everything that I do when I'm doing the skills is what is required by the state of New York. So if you see me wash one arm or one hand, that's what is required. So you don't have to worry. Everything that I'm putting inside any one of the skills that I'm doing, it is what is required by the state. All right, so now I'm going to begin the skills, and of course I'll be explaining as I go along. Remember, there are 5 things that they look for when you're doing the skills: direct and indirect contact, infection control, safety, and privacy. Now, when I say this, people tend to say that, is this all they're looking for? No, but these are the 5 major things that they look for in the exams, all right? So we're going to make sure that when we're doing it, I'm going to highlight what is safety, what is infection control, and all of that to you guys, all right? So let's begin. Now, I'm going to be doing my indirect and direct contact throughout the skill, because I'm going to introduce myself, and sometimes you'll be seeing me touching the person. And it's directly means that I'm really touching the person directly. Indirectly is me speaking and informing her of whatever I'm doing. You know, the patient has rights, and you must inform the patient whenever you're going to move her, whenever you're going, whatever she needs to wear, and she also has the right to deny your service. All right, so let's go. Good morning, Mrs. Jones. My name is Simone Rurig, and this morning I'll be your nursing assistant. Mrs. Jones, I'll be assisting you with partial bed bath. Is that okay with you, Mrs. Jones? Okay, Mrs. Jones, I'll go wash my hands and I'll be right back. Notice that I asked her if it's okay with her. She said yes. So now I'm going to be washing my hands. But before I wash my hands, I will be giving Mrs. Jones privacy. So I come here and I give Miss Jones privacy. Now I'll be washing my hand, my infection control, right? So I'll be washing my hands. So I wash my hands here. After washing my hands, guys, I come back to the bed, and I'm going to make sure that the person in bed that I'm giving the service or the care to is Mrs. Jones, by asking her questions. And also, these questions is to make sure that Mrs. Jones is alert. She's not confused. All right, so these are the questions. Mrs. Jones, may I see your ID bracelet, please? So she shows me her ID bracelet. Question: what is your name? She answers. What is your date of birth? Thank you, Mrs. Jones. I'll go gather my supplies and we can begin. No, I know that it's Mrs. Jones because she told me her name. I know that she's not confused because she can tell me her name and she knows her date of birth. That means her mind is alert. Notice, guys, in life, if the person is confused, what we need to do is to tell the nurse, all right? But Mrs. Jones is okay, so I'm going to gather my supplies. Now I know I need to go to this drawer. Anytime you're opening a drawer or you're turning on the tap, you need a paper towel to hold the knobs, all right, guys? So I'm going to come here and I'm going to pull the drawer open. And here, I know I need my basin I know I need my soap, and also I need my lotion, because I know what my skills entail. All right? Closing the drawer. This piece of towel is now considered dirty. I just open the drawer, close it. So I'm going to just place it here to throw it away on my way around. Now, my other supplies that I need, that I know I need my privacy blanket. Notice when I take my privacy blanket, I don't place it here because the supplies are not supposed to be touching your clothes. I place it over more on the base, on the front of the base, on the edge, just for balance, all right? And I will be holding my supplies away from my clothes. So I know I need a large towel and a small towel. I also know that I need a gown, and I need 7 wash rags. So I have all of this right here. Notice it's away from my clothes, and notice guys, I'm balanced, nothing is falling, because I made sure the foundation really is the blanket on the edge of the basin, all right? So when I reach here, I want to, just throw away the garbage in my hand, and I come here. I know I need a chuck for the table, and of course I need a pair of gloves. When I come here, I put my gloves, I put my chuck on the table. Notice when I'm putting the chuck on the table, I place the chuck on the table, then I open it. I never shake the chuck in the air. I put my gloves down, take my rag, then I take my basin, and I flip my blanket here. Now, I know that I need water. Notice I make sure I have all my supplies ready, then I go for my water before I wind up the bed. Remember, you never step away out of the room with a resident up in the bed. Reason why, you have to protect the resident's safety. Okay guys? So now I'll be getting the water. As I said before guys, when you're turning on the tap, you need a paper towel. So I turn on the tap. I test the temperature of the water before I throw away my towel. The temperature is okay, so I throw away this paper towel in the garbage. I get my water, take another paper towel, turn off the tap, and that's it. Now, before you touch the water to the resident or the patient's skin, you must ask them to feel the temperature of the water, all right? Mrs. Jones, can you test the temperature of the water to see if it's okay? And she puts her hand in the water, and she says it's okay. Okay, guys? So I put this down. The next thing I'm going to do is to wind up the bed. Before winding up the bed, I put on my gloves. So, when I was doing partial bed bath and catheter, I would wind up the bed first before putting on my gloves, because I would be touching the person's private area, right? That's different. Now I'm going to be using water, so I'll wind up the bed first. I'll put on my gloves first, then wind up the bed, all right? So I'll be winding the bed up. So when I come here, guys, I'll be bending or stooping to wind up the bed. Remember, good body mechanics. We cannot wind the bed up like this. We must stoop or we must kneel on one knee. All right, so I'm going to be stooping, and of course I'll be winding the bed up. After winding the bed up, I'll be locking the bed. Lock, lock. Now I'm here, I'll be taking the mitre out of the bed, from the sides of the bed. Notice guys, when I'm working side to side. I never work at the back of the bed. And I will be putting on the privacy blanket and taking the top covers down. Mrs. Jones, notice I'm going to inform Mrs. Jones what I'm doing. Because you don't want to shock her, you don't want to make her uncomfortable, right? So, Mrs. Jones, I'll be putting your privacy blanket on, and I'll also be taking your top covers down. So, I'll be opening. That's me putting on her, and then I'll be taking the top covers down to the bottom of her feet. And that's what I do. The next thing I'll be doing is to place the large towel across Mrs. Jones' chest, because I don't want to wet up the bed or water to run down her and wet her pillows, all right? Or pillow, sorry. So I'll be opening the towel across Mrs. Jones' chest, and then I'll begin washing her face. Remember guys, I told you when we are washing the face, we never use soap. So I'll wet the first rag, wring it dry, and I'm going to be washing Mrs. Jones' face. Notice I'm making a mitten. That's what we use when we're cleaning our patient. So I'm going to be wiping the far side from in to out. All right, with my pinky. Okay, Mrs. Jones, let's begin. In, out. Then I'm doing the near side with my index. In, out. Far side of the face, near side, middle, behind the far ear, and then the near ear, and I'm finished. Notice when I'm finished using the rag, I'm going to store it away from the clean. So I'm going to be using the towel to pat dry the face. But you know the small towel, so you know that, you know, the eyes are sensitive and the face is a bit sensitive. So I'm going to be using the middle part of the towel to pat dry. Same way I wash, in, out, far side, near side face, middle, behind the far ears, near ears, and I'm finished. The next part I'll be cleaning is the arm. So this towel that I had placed across her chest, I'll be putting it under the arm so that the bed does not get wet, okay? So it's going to be placed from the shoulder. So Mrs. Jones, let's continue. Placing the towel under Mrs. Jones' arm. Okay, and it's right under her arm and up under her shoulder, okay? Now, remember, I'll be washing Mrs. Jones' arm, so I need to remove the gown. When I'm removing the gown, I'm going to be, so Karabi, can you come for me, please? I'm going to show you how to lift Mrs. Jones. So when I'm going to take off the gown, I'm going to put my left arm under Mrs. Jones' shoulder. I'm going to put her up, hold her with my right hand, and I'm going to use my left hand to untie the back of her gown. All right, guys? So that's what I'm going to do now. Okay, Mrs. Jones, I'll be lifting you, placing my left hand under Mrs. Jones' shoulder, lifting her up, use my right hand to hold it, pull the back of the gown. Okay, Mrs. Jones, let's lay you back down. Very good. And I'm going to be taking off the gown now. So, this is me taking off Mrs. Jones' gown. Notice, I'm not exposing her. I push the gown to the far side. Then I walk around to the far side and I'll be finished removing the gown. Alright? So I'm finished removing the gown. And then I'll be taking it away by rolling it away from Mrs. Jones. Alright, guys? So I'm rolling it away from myself and from Mrs. Jones. I place it in the hamper. And it's in the hamper. Now I'm going to come back here and I'm going to continue. So I told you that I'm washing the arm now. Remember, the towel is under the arm. So guys, remember, we need 2 wash rags now, because we're going to use soap and then we're going to rinse. So I take one, I need soap, and then I lather the soap on the rag and I'm going to begin washing the arm as I showed you before. So wash the top, Go down to the back of the hand, turn her hand over, wash between the fingers, up in the inside of the arm, and you finish under the arm of the patient. When you finish washing, dirty, you place it with the dirty. And I'm going to rinse. Same way you wash, you're going to rinse, all right? So this is me, and I'm going to rinse. Same way I wash, I'm rinsing the back of the hand, between the fingers, up, under the arm, finish rinsing. So now guys, I'll be pat drying. Remember, I wash with soap, I rinse, now pat dry. Pat dry, pat dry, pat dry. Between the fingers, pat dry, pat dry, pat dry. And I'm finished with the arm. The next thing I'll be doing is to wash the front of the torso. So I need 2 more wash rags, right? So I'm going to continue. And I'm going to put soap on the first rag, lather. And I'm going to wash the front of the neck, the shoulder, under the breast. And I'm going to stop right in the middle. So I'm washing the neck, the shoulder. Of course, I'm washing the breast. And when I reach the breast, I'm going to lift them, all right? Lift. And I stop right in the middle of the midsection right there. Dirty to dirty. And anywhere you wash with soap, you must rinse. It is as simple as that. So I'm going to rinse now. The neck, front of the neck, shoulders, lift the breast, that. Finish. Dirty to dirty. After doing all of that, I'll be pat drying. Pat dry the front of the neck, under the breast, lift again, and then I'm finished. Now, I will be washing the back now. So I need my partner to stand to the side, and I'm going to ask Miss Examiner, may I have my partner stand to the side for Mrs. Jones' safety, and Karabi is going to assist me now, all right? She said, the examiner said yes, all right? So remember guys, when you're turning the patient, we turn them in 3 tiers. But what happened is that we don't want the patient to slide off the bed. So what we're going to do is to try our best to get the patient closer to us and then begin. So let me explain this better. So Mrs. Jones is lying in the middle of the bed. If I turn her directly, if I turn her before pulling her towards me, she's going to be far away from me. And that is also a safety hazard when the person is lying at the edge of the bed, right? So I'm going to try to turn her to me, pull her to me, and then turn her so she's closer to where I'm standing. And I have a good view of what I need to get done and a good reach, all right? So when you're pulling anyone, you must, first of all, let me remove the towel from under her arm, put it to the edge of the bed, and begin. Mrs. Jones, I'll be crossing your arms and legs. Remember guys, whenever you're moving the patient, make sure her arms and legs are crossed. You don't want any part of her body flaying or getting hurt. All right, Mrs. Jones, on the count of 3, I'll be pulling you towards me. 1, 2, 3. So when we're moving persons, we move them in 3 tiers. Shoulder and hip and knee, and knees and ankle, right? So I move her on the count of 3, 1, 2, 3, shoulder and hip. Then I'm going to move her again, hip and knees, and then move her again, knees and ankles. So she's closer to me right now. Now I'm going to turn her. Mrs. Jones, on the count of 3, I'll be turning you. Notice when I'm turning her, my hands are under the covers because I want when I turn her, the covers fall down and she's not exposed like this. Mrs. Jones, on the count of 3, I'll be turning you. 1, 2, 3, turn. Notice I turned her, and this is what happens. One moment, guys. Let me just remove the bag like how we're not using it. I'm sorry, guys. I just want to move the bag out of the way because we're not using it at this moment. So let's continue from here again. On the count of 3, 1, 2, 3, let's turn you. And I turn, and the covers fall. Now guys, I need to wash her back. wash her back, I'll be putting the towel under her back because I don't want the bed to get wet. Like this. And I put the towel there, and I'm also now going to just expose where I need to wash, like this. Alright? So now I'm going to put the last 2 wash rags in the water. Then I take one and I'm going to get soap, lather, and I'm going to wash the back of the neck, shoulders coming down right there. Finish. Dirty to dirty. Now I'm going to be rinsing. Back of the neck, shoulders, and I'm coming down. I'm finished. Now, anywhere you wash and rinse, you must pat dry. So the back of the neck, shoulders, pat dry, and I'm finished. Now, the next thing we need to do is to lotion our back. Notice, guys, make sure the dirty don't mix with the clean. So the next thing I'm going to do is to pour lotion in my hands. When you read your paper, another person says, what do you mean by warming the lotion? It only means you pour the lotion in your hand and you lather it, like rub it. You feel that warmth after rubbing the lotion in your hand for a certain time, yeah? Now, when I'm doing the back, I'm going to massage the lotion on the back. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now I'm going to do it inward. 1, 2. 1, 2. 1, 2. After rubbing the lotion on the resident's back, next I'll do is to take away the excess lotion by pat drying it. So I pat dry the back, pat dry, and I'm finished. The next thing I do is to remove the towel, put it to the dirty, because I'm finished with it, and I'm going to be putting on Mrs. Jones' gown. Before I put on the gown, I'm going to say, Mrs. Jones, and the count of 3, let's put you back to lay down. 1, 2, 3. She's back lying down. I uncross her legs, her arms and legs, and of course, I'll be dressing her now. So, okay, Karabi, it's okay. Okay, guys, before Karabi sits, let me show you what I mean before I continue with the video. Come, Karabi. You're going to turn your back towards me. Now, when I was doing the lotion to the resident's back, that's what I want to show you what I was doing, all right? So I'm going to lather the lotion in my hand like this. Then I'm going to 1, 2, 3 outwards. 1, 2, 3 outwards. 1, 2, 3. And then I'm going to come back down in 2s, but I'm going to go inward. 1, 2. 1, 2. 1, 2. And then I will pat dry the excess lotion. That's all I did when I was doing that to Mrs. Jones. Okay, guys? Thank you, Karabi. Now, after pat dry Mrs. Jones' back and putting her back to lay down, I will be putting on her gown. Now, notice, guys, I don't shake the gown in the air to open it or anything. I lay it on the bed and I take my time. I open it. And, of course, I'm going to, as I said, open the gown. And I know this side is over. I'm going to put it over to that side. So I'm going to lift the privacy blanket and I'm going to place the side that needs to go over to the other side, like this. And I'm going to put on Mrs. Jones' gown. So I only put my hands inside the hand of the gown, pull it up on Mrs. Jones like this. Very simple, guys. And now she has on the gown over this side. The next thing I do is to go to the legs. And of course, I'll be putting on the gown, finish putting on the gown over this side. So I'm going to put Mrs. Jones' hand here. I could continue working over here by tying the back, but my hand is not. This hand is much more manageable when I'm lifting Mrs. Jones. So Mrs. Jones, remember when you're lifting the patient out of the bed, I'm going to lift her with my left, I'm going to hold her with the right, and I'm going to tie the knot behind her. So Mrs. Jones, on the count of 3, let's tie your gown. Let me lift you. 1, 2, 3. So I lift Mrs. Jones, hold her with the right, and of course I'm tying the back of the gown. And I tie the gown, put her back to lay down. Okay, Mrs. Jones, make sure her gown is okay. See, this is how Mrs. Jones look under because she has on her gown, right? So now Mrs. Jones, I'm going to be pulling your top covers up and taking away your privacy blanket. So when I'm doing that, I must pull the top sheet back up over Mrs. Jones like this. And then I'm going to take away the privacy blanket by pulling it down and pushing it over to the side where I know the hamper is, all right? So that is all I'm doing, taking away the privacy blanket without exposing Mrs. Jones. So when I'm taking away the privacy blanket, guys, I roll it away from myself and Mrs. Jones, and I don't allow the blanket to fall like this. It should not be like this. It should be rolled away, rolled up like this, all right? And I place it in the hamper. Now I'm going to be fixing my covers, fixing back Mrs. Jones' bed. You can work from any side you're on, but I like to fix that side first because this is the side where I know my examiner is. Although some examiner walks around, but I like to fix this side of the bed first. So you can work any side first, guys. Now I'm fixing the bed, and I want to see if my sheet is, I want to make sure my sheet is okay. So guys, notice if the sheet is not okay and you want to pull it over towards you, you never pull it on the person. You lift it like this. Mrs. Jones, let me lift your sheet a little. Lift it and let it fall, all right? Lift, pull, and let it fall. And then you finish fixing your bed. Guys, notice I'll be making the mitre. Under, and it's like this. You lift here, have the bed like this, the sheet like this, tuck this side under, and here's your mitre. Come to the next side or the other side, same procedure, and there's your mitre. Okay, and you finish making the bed. Now guys, remember, not because you see me doing in the exam, you're not supposed to have on this here. Your ear must be pulled behind you or up in your head. You notice this hair giving me a problem? No, I'm not supposed to be touching my hair and working on the patient like this, all right? So make sure your hair is, tidy. Now, the next thing we're going to do is to wind down the bed. Notice I finished making the bed, so the next step is to make sure the bed is in the lowest position because I need to get rid of my garbage, okay? So, Mrs. Jones, I'll be winding your bed down. Remember, good body mechanics, and I'm winding the bed down. Now, I make sure the bed is in the lowest position, and I'm going to lock it. Lock, lock. So, Mrs. Jones is okay. The next thing I'll be doing is to take away the water. Notice I take away my garbage, not everything at once. You have to take them in sequence, right? So the first thing is the basin with the water. I throw away the water, take a hand towel, turn on the tap, throw it away and wash my basin. And then I take another hand towel, turn off the tap, throw it away, and now I'm going to be drying my basin. Dry the inside, throw away the hand towel, take another hand towel, dry the outside, throw it away, and then we take another, and of course, we place it under the basin. The reason why we place one under the basin is that just like when you drink in your glass, you don't want to leave it on the table. It makes a mark. It leaves a mark there. We do it. It's the same concept when we're putting the basin in the drawer. So I place one under there in my hand like this, And also, remember, we had this conversation about taking a towel to open the drawer, a paper towel, all right? So remember, I did take the lotion and the soap when I was taking it out to use on Mrs. Jones. So now I'm finished, I'm putting it back, all right? So when I open the drawer, with my paper towel, I put this in the drawer because we need it not to, we don't need to leave a mark in the drawer. And I place the basin on it. I close the drawer with the one that I used to open it, and I throw it away. The next things that I will be taking, supplies that, these supplies are washable supplies. They're not disposable, these are washable. So I'm going to be putting them together, rolling them together, and I'm going to put them in the with the washables. All right? And this is in the hamper where the dirty stuff goes. The next thing is disposable, which is the chuck. These are disposable chucks, right? We roll them away from ourselves and we throw it in the garbage. So I throw this away. Now, I'm finished with my garbage and everything. The next thing I'll be doing is to give Mrs. Dozer a call bell, because we want to make sure Mrs. Jones can contact us if we need something if she needs something, all right? So when I fix the sheet, when I fix the finish fixing Mrs. Jones' sheet, you know what we should have done was to give her some toast paste. Because guess what? We don't want Mrs. Jones' toast to rub on the sheets or such. So I am going to Mrs. Jones, I'll be giving you some toast paste. We should have given her the toast paste when we were finished making the bed. Alright? But now I remembered, so I just gave her the toast paste. The next thing I'll be doing, as I said, was to give her call bell. Mrs. Jones, here's your call bell. Feel free to call me if you need anything. And then I undo the privacy. No, I'm undoing the privacy because I want Mrs. Jones to feel comfortable by seeing other roommates or the nurse or people passing, because she's looking fine and she can see outside and she's okay. And the next thing I do, guys, after opening the privacy is to come here. I'm going to take off my gloves. When you're taking off your gloves, guys, you must pinch in the middle. Take it off your hand like this. Roll it in your hand. 2 fingers in the other glove. You're going to roll it over. See this? And you're going to dispose of it. The next thing you do is to wash your hands. After washing your hands, you come back, you stop a little, you look around, and you make sure that the bed is in the lowest position. Mrs. Jones has her call bell. There's no garbage on the ground. There's nothing in the way for anyone to fall. The privacy is open. And of course, you say my skill is finished. Now, guys, I hope this video was informative. And I hope, guys, that all the videos that I put online enriches your education in passing your exams. So guys, another video was made. Whoop whoop, I did it again.